we've interrogated the cancer cell. Here's what we do. We take these tumor cells and we put them in saline, which is a salt solution, no fuel, nothing. And then we see how long it takes them to completely die. Without fuel, remember, without energy, nothing can survive. Energy is everything. The whole cancer issue is energy, energy, energy. So how do you know what a cancer cell needs to survive? You grow it in salt, and then it dies. It dies. And then we add stuff back, one at a time, one at a time. And we find the things, and all of a sudden, you add glucose back, boom, this thing starts growing again, even in the salt. Okay, so then we add each amino acid back. And we found out that the amino acid glutamine, together with the sugar glucose, is the most robust driver of dysregulated cell growth. There are other amino acids. They can play a minor kind of a role, but nothing like glutamine. Now, targeting glutamine, you can't do it very effectively with diet. Vigorous exercise can lower glutamine levels, but you need drugs. And in our mind, those drugs are parasite medications, okay? Because the parasites and the sugar, the parasite and the cancer cell use common metabolic pathways, if you can believe it. So you bring the patient down into this new super healthy state, and you go after the glutamine and the glucose simultaneous. Unbelievable. You probably can't appreciate how powerful what I just said to you is until you actually see it yourself. And the problem is most people don't see it, and they think, oh, you know, what food can I eat for glutamine? No. You got to use it. You can get it down, but you can't really get it to below this like threshold. Once you get it below that threshold, don't forget, these tumor cells have to have a lot of fermentable fuel. They're not energy efficient like our normal cells. Our normal cells can live on the most minuscule amount of nutrient in the environment and still be healthy. The tumor cell has to have a buttload of glucose and glutamine. Once you go below a certain threshold of levels, these tumor cells, they up and die because they ran out of energy. So that's the whole strategy. Simultaneously cutting off the two fuels that drive the dysregulated growth, while at the same time transitioning the body to ketones, which we evolved to burn in times of fasting. Okay, tumor cells can't use fatty acids in ketone bodies.
Yes.
So you starve them. They're marginalized. They're weak. They have all these genetic mutations. Sure, they have a lot of mutations. That prevents them from adaptability. So unless you understand evolutionary biology like we do, you might have difficulty understanding how we put all the parts of the puzzle together to get the outcome, and understanding how these cancer cells have deviated from the way we understand biology and biochemistry to work. And once you understand that, these cancer cells are sitting ducks for all kinds of attack that's not harmful to the body. I'm always saying, prove me wrong. Show me a cancer cell that can live without glucose and glutamine. I've been throwing that out to the field for a long. Nobody shows me. Whatever you're eating must be nutritionally balanced. And what I mean by that, you cannot be deprived of macro and micronutrients in whatever you're eating to keep your normal cells healthy. But whatever that is, again, it comes back to measure your glucose ketone index, and then you'll know. Now, fruits are interesting because when I worked in the epilepsy field for years and years, we would manage children on metabolic therapy, ketogenic diets for months, and then they would take a bite of some sweet thing like an orange or an apple or orange juice, and they, within a very short period of time, would explode into an epileptic seizure. So it was quite clear how fast we could remove the suppressive effects and have the outcome. With cancer, we don't see that. But when we were working with epilepsy, we realized that grapefruits had an opportunity to maintain good vitamin C, but not jack sugar up too high. You can't see a few extra tumor cells growing like you can see a full-blown epileptic seizure. So we were able to see how powerful constant management of blood sugars in children with epilepsy, how important that was for maintaining resistance to seizures. The mechanism by which that happens has not been as clearly defined as the mechanism by which killing cancer cells works. This is an amazing thing. many of my colleagues in the epilepsy field are still working very hard to try to figure out how these diets, ketogenic diets and things, and modified Atkins diets and all these can manage epileptic seizures. But for cancer, we know very clearly how it works. IV vitamin C leads to oxidative stress in cancer cells. So again, you're causing oxidative stress. But the issue, of course, is if you have fermentable fuels in the cancer microenvironment, which is glucose and glutamine, they have a very powerful antioxidant capability. Okay, so glutathione and superoxide dismutase and all of these are powerful antioxidant systems in the cancer cell, controlled by the fermentation metabolism. So as you degrade the fermentation, which is the removal of the fermentable fuels, the tumor cell will naturally become more vulnerable to oxidative stress, whether it's through hyperbaric oxygen, IV vitamin C, or other kinds of approaches that would increase oxidative stress in the cancer cell, but not in the normal. If the normal cell is burning ketones, it's very resistant to oxidative stress because it's a very different energy metabolism for burning ketones in normal cells, and the cancer cell can't access that kind of metabolism. They're locked into this ancient pathway of energy. Yes, and that's because they're burning ketone bodies. Yeah. So we evolved, but the mechanism for that was worked out by my late good colleague and friend Richard Veitch at the NIH. It's a very complicated biochemistry. 25 to 26% more energy efficient when you burn ketones than when you burn glucose. And fewer oxygen-free radicals are produced as well. So it's an anti-aging kind of a thing. So, but the normal cells can do that. The tumor cells cannot do that. So they're compromised, they're restricted, they're marginalized. Because of all the mutations that they have, all these mutations. Nobody's arguing with the mutations. They're downstream effects that block the flexibility of those cells. They're locked into fermentation. They're no longer flexible. So once you move the whole body into these new metabolic zones, these tumor cells get hammered. It's very, very hard. If all cancers or the majority of cancers are due to damage to the organelle, the mitochondria, that make energy through oxidative phosphorylation, in order to get cancer, that organelle must be damaged. So if you can keep that organelle healthy, it's very unlikely you're going to get cancer. And this was seen in our Aboriginal folks, the Inuit, African tribes, rainforest people, Aboriginals from Australia. If these guys live according to their natural ways, cancer is extremely rare, okay? So they're not eating fast foods on every corner. They're not sitting in front of their computer screens. Whatever they're doing, they're getting a sufficient amount of exercise, and they're eating foods that enhance the health and vitality of their normal cells, and they don't get cancer. And or cancer is extremely rare. Okay, not 1,700 people a day dying like we have in this country, and in China it's like 8,000 a day because they have a bigger population. So in fact, in China, the cancer has now replaced heart disease, cardiovascular disease, as the #1 killer. So once people know how you get cancer, how it starts, how it progresses, and what you need to do to prevent it, then you can drop this whole thing. If they can't get energy from fermentation, they're going to die. So that's what that is. So I mean, that's the bottom line. Without energy, they're going to die. They can't respire. They can respire a little bit, which I mean they can get small amounts of energy from oxygen, but it's not sufficient by itself to keep them alive. They have to have the fermentation machine going at the same time, which is driven by glucose and glutamine. Okay, so that's another thing. When you take away the fermentation, the two fuels that drive this ancient non-oxygen energy metabolism, and then you give them oxygen, you create tremendous oxidative stress in the tumor cell because the buffering against oxidative stress is the fermentation metabolism. So if you lower the fermentation metabolism and put them in like hyperbaric oxygen or something like this, you greatly increase and explode the tumor cells. But you got to get rid of their protective fermentation metabolism first. That's why we use hyperbaric oxygen only when the patient is in a low glucose ketone index. Now the tumor cells are going to be massively vulnerable to hyperbaric oxygen, possibly vitamin C, possibly a lot of these, IV vitamin C, anything that will increase oxidative stress, because don't forget, that's why radiation kills tumor cells, oxidative stress. So, but radiation does a lot of collateral damage.
Right.
So you want to do the same thing radiation does, except making the microenvironment super healthy around the tumor cell. Get rid of the acidity. That's another thing. These tumors are very acidic because the waste products of fermentation acidify the microenvironment. So again, if I take away the fermentation fuels, the acidity goes away. They become vulnerable to oxidative stress. You're breathing, right? I'm breathing. All the folks are. This is called oxidative respiration. We're using oxygen to get energy in the mitochondria of the cell. Okay, the cancer cells don't use oxygen to get energy. They do fermentation, totally different. It's energy without oxygen. You have to realize that all the organisms on our planet 2.4, 2.5 billion years ago were all fermenters. There was no oxygen in the atmosphere, but we have fossils of all these cells that were alive. They're all fermenters. So they're using ancient pathways of energy metabolism, not requiring oxygen, and that's called fermentation. Cancer cells are locked into fermentation for energy. They don't use oxygen or very little oxygen. So we know how to kill them because they have fallen back as the ancestral cells that existed on the planet all these billions of years ago. So that's why when I'm saying evolution, you got to know how organisms developed and evolved on this planet. And then you know what the cancer cell is doing differently. And then you say, how is it living? What is it doing? It's doing the same thing cells did 2.5 billion years ago. And what happened in that time, when the fermentable fuels in the environment were used up, these cells would die. And we're seeing the same thing happen to the cancer cell. When you take away their fermentable fuels, the cells will die. So it's how effective you are, how effective the strategy is in depriving the tumor cells of their fermentable fuels, which are predominantly glucose and glutamine. If people were really interested in not getting cancer, we would not have an obesity epidemic, especially among little kids. We're putting those little kids at terrible risk for all kinds of chronic diseases. It's a tragedy, and you can see it happening right before your eyes. All of those kids, they're already putting themselves at tremendous risk for not only cancer, but diabetes, type 2 diabetes, cancer, cardiovascular, dementia. All of this stuff is related to the same problem. And I don't think the word is out that this is a tragedy. And now I'm seeing, and now this paper is published, that cancer is now striking younger and younger people all the time. Wow. In their late 20s, 30s, and early 40s. And that's because of the diet and the lifestyle that we're in. It's not a genetic predisposition. It's the diet and lifestyle that we are currently in. And once you know that, then you are in a position to do something about it. So if we built that for the cancer, especially glioblastoma patient. But now on the web, I'm seeing more and more health gurus and all these weightlifters and bodybuilders and just super healthy guys, all using the GKI to see how healthy they can become. So I didn't make it for that, but that's prevention. You keep low GKI, it's going to be hard to get cancer, especially if what you're eating is nutritionally balanced, macro and micro nutrition. So if that happens to be a vegan guy, a carnivore guy, a pescatarian guy, a Paleolithic guy, I don't care. Whatever they're doing to get that ratio down is probably going to be healthier than not getting it down. We have some of our students sometimes used to be every day, big smiles on their face. They come in, they love life, they love everything. And then when they try to fast for several days, they sit with a moping looking face. Yeah. I mean, it's not a friendly looking face. So nobody's smiling and saying, oh, how great it is. I haven't eaten anything for 25 days. Look at how great I feel. No. It should be brought in. You can dovetail it to whatever religion you happen to be, give it up for the greater glory of God or something like this. Whatever can be dovetailed to help you do that. But I think it's easier if you go on a low carb diet for several weeks, get a low GKI, and then jump into a water only fast. We don't use any drugs except the ones that are going to kill cancer cells. So, and the drugs that we use, I said, we use at low doses. And that's what the dosage, timing, and scheduling part of the press pulse concept. We're not there yet in perfecting the strategies for what dosage, timing, and scheduling. You can use some of these drugs that will target glutamine. It's easier to target glucose with diet and lifestyle, but glutamine is a little bit more difficult. Unless you're doing a pretty good vigorous exercise, you can lower glutamine. But I don't know if it's lowered to the point where the tumor cell would be eliminated. That's why we use a little bit of a drug to push those over the threshold and kill them. And you don't want to ever use any kind of a drug that has a remote chance of harming a person. That tells you you're not doing it right. Okay, so all these terrible toxic effects you see the poor cancer patients, this is not right. This is wrong. This speaks to a profound lack of knowledge on the biology of the disease they're treating, because you can kill cancer without having to do any of this stuff. It's just that it's not known to the majority of people, or the oncology field, or the National Institutes of Health. So it's just a wall of, and then when you talk to those guys about it, oh, I don't know, hasn't been tested. Oh, no clinical trials. And there's always a non-scientific argument for why it won't work. It's not like, oh, did you see the science? No, but it won't work. And it's like, give me a break. It's anyway, it'll be the future. You know why? Because the people want to live.
Yes.
There's a compliant population that want to do this. Our adversary is a dysregulated tumor cell.
Yep.
And our goal is to kill it, okay, without causing collateral damage. And also, whatever you do to maintain the health and vitality of your body. My colleagues take extensive blood work on the patients. So, and you can look at all the salts and the micronutrients in the blood, and you can look at all this. So you got to keep that patient in the zone of health. And whatever that does, as I said, if he needs to eat a head of broccoli to do that, let him eat it. This other guy wants to bite into a chunk of ribeye, let him do it. The issue here is you got to maintain metabolic homeostasis, and one shoe does not fit all.